Welcome to the National Conference on Sexual and Reproductive Health and Rights in Bangladesh 2023, organized by ISDDRB under the EdSearch project. This is Abdullah Al Rifat. I am a graduate student at Department of Anthropology at Shahjalal University of Science and Technology, Sylhet. I am here today to present to you our research on male adolescents, challenges and sufferings regarding sexual and reproductive health and rights. It is a qualitative research conducted in 3 selected urban slum, Sylhet. So, according to the Bangladesh Bureau of Statistics 2014, 22% of our total population is adolescents. In number, they are 36 million. Among them, 2.23 million adolescents live in slum context. So, engaging male in sexual and reproductive health and rights is global public health concern today. But in Bangladesh, accessing in sexual and reproductive health right information is very challenging still now. More especially in poor slum dwellers due to their socio-economic condition. And then, boys are remain more vulnerable because for a long time our research and policy efforts they get less focused. Therefore, this study aims to address 2 issues regarding boys' sexual and reproductive health rights. One is to understand the knowledge status of male adolescents regarding sexual and reproductive health and rights in slum context. And then their challenges and sufferings regarding gather this knowledge and information in the slum context. So to achieve this knowledge, we adopted a qualitative exploratory research method, and we used focused group discussion and IDA for data collection. We selected three slum under Sylhet City Corporation and purposefully selected these 3 slum, and then we chose we selected 3 ward under Sylhet City Corporation, and from each ward we randomly chosen 2 slum for our interview. So we in all total interviewed 31 participants from this selected ward. They are 13 to 19 years old male adolescents. So our data was analyzed using thematic analysis, and our data number of participants. Our number of participants is determined by following data saturation principle from Brown and Clark's. So, our findings. Knowledge about sexual and reproductive health of male adolescents in the slum context. We found that most of the participants know what is sexual and reproductive health and rights, but they cannot express it in their words. What is it? They cannot express it. To them, wet dream is the major and primary sign to being an adolescent. And then they also identified beard, changes of boys, changes of attitude, attraction to women are some of the sign to being adolescent. So their sources of knowledge. We found that mainly friends and their peer groups are their most reliable and comfortable source of gathering knowledge. They do not go to their parents and their elders, their brothers and sisters. So we have a question, why they do not go to them, their close persons. So answer is, we found that most of the male adolescents feel shy to discuss the sexual and reproductive health and right issues to their known person, even their parents as well. So they have some challenges for gathering information. Main challenges them is accessing information from their formal and informal sources. Formal sources like educational institution, hospitals, specialists on sexual and reproductive health right issues. All of these sources constrained by their socio-economic condition, mainly their poverty. And then their informal sources like their parents, their community experience member, their elders, brothers and sisters. These source constrained by their shyness, ignorance, and fear of being stigmatized. These these three things mainly major barrier to accessing in knowledge. So they have some social sufferings based on this challenge. Like boys' sexual and reproductive health rights is socially negative. It's sometimes stigmatized. It's sometimes matter of fun to the others. Sometimes ignored by the elders and experienced person, and it's tend to hide to others as well. And it's not important concern as in compared to women. So our analysis showed that male adolescents have lack of knowledge, they have lots of misinformation and unhealthy practice regarding sexual and reproductive health and rights. So the consequence is that all of these sufferings and challenges lead the male adolescents to refuse to disclose the sexual and reproductive health issues even if they have any problem and disease as well. They have fear of stigmatized, they have fear of being negatively marked, and their shyness. And then our analysis also showed that the socioeconomic and institutional barrier forcing them toward health inequalities. So our suggestion is that to ensure quality education for all, policymakers and decision makers must focus on boys for a separate program that may help to break the mindset that sexual and reproductive health and right is not only the primary concern for female, it is a vital and important concern for male as well. Thank you.